Good morning, guys. I hope we're all sparkly. We spend a lot of time trying to legitimize testosterone deficiency and testosterone replacement therapy. Unfortunately, it's a bit of a joke, isn't it? Jump on TRT, see how you feel, give it a whirl. It drives me mad. So the cardinal presenting symptoms of low testosterone are low mood, anxiety, depersonalization, brain fog, troublesome fatigue, low libido, the list goes on. But go onto YouTube and you will see I started testosterone and I have such incredible gains. It has made my life complete. As if aspiring to have a chiseled, godlike physique is all that's really important in life. Now, having a chiseled, godlike physique is pretty cool. Those days are gone. But inner peace and tranquility are far more important. Now, where do you get that? Not the internet. YouTube is flooded with, is he natty? Is he not? I literally couldn't care less. If you have to ask the question, you already know the answer. So it's just idle gossip. Since you can't prove anything, it is going to be a circular argument. He's not on steroids now, but he was on steroids. You can tell he packed on 20 to 40 pounds of muscle in 1 year. Yeah, that's gear. You know, give me a break. Wow. How did you do that? Well, I started lifting weights and I started eating right. Listen, you want to put on muscle, blood and guts. Eat, sleep, train, repeat. Train hard, rest well. Repeat that cycle. Perseverance, consistency, and pushing yourself to the limit. Pushing yourself past the limit. Because you need to create those little micro tears within the muscle for anabolism, to stimulate muscle growth. The testosterone will bind to the androgen receptor and create a positive nitrogen balance and help synthesize proteins and prevent protein breakdown. But there is no substitute for hard motherfucking work. And nobody wants to put the effort in anymore. I want to get big quick. 12 weeks and you can look like me. It's going to take a lot longer than 12 weeks because they've all got little secrets. It's just chicken and rice. Yeah, pull the other one. So it's unfair. It's unfair to compare yourself with one of these fitness influencers because you will never meet expectations. Now, partly they may have good genetics, but they've been naughty. Give me a break. These guys are not clean. Just look at some of the world-class athletes. They don't have these chiseled physiques, if they're natural. And lots of world-class athletes aren't natural. But we are causing harm by allowing this to go on. We are causing harm by giving these people airspace. Is he natty? Is he not? I literally couldn't care less. What I'm concerned with is this. I want to improve my health. I want to improve my sense of well-being. I do not judge my performance by some fitness influencer. Now, Felix and I train together. Now, in most things, I'm stronger than him. However, weighted pull-ups, he is leaps and bounds ahead of me. I'm not even sure I can do weighted pull-ups. I can do a lat pull down of 120 kilograms, but I can't do weighted pull-ups like Felix. It's amazing. Do I care? No, not at all. My physique is not made for weighted pull-ups, but it could be if you practiced. It could be if I practiced, but I don't care. Disappointingly, I've got bony, girly wrists. So my grip strength always fails me. So when I do a back workout, I use straps. It is what it is. It's my genetics. Can I defy my genetics? Yeah, of course I can. I can take gear. I can become the person I want to be. I can be just like you. I don't want to be just like you. I want to be me. I don't admire anybody on the internet. It's absurd. I want to be just like you. It is pathetic. It shows a level of insecurity and a lack of self-esteem that is only propagated by continuing to click like and subscribe to these monkeys. I really, really, really can't stand it. And then you see doctors selling themselves out. Shut up. It's pathetic. Have some integrity. Testosterone deficiency is a well-recognized medical condition. Some of my guys have severe mental health problems as a result of low testosterone. Some guys are really struggling, and trivializing TRT, trivializing the journey to hormone optimization doesn't do you any good. It doesn't do that person suffering any good. It's like, let's raise awareness for mental health. It isn't going to help anybody. It's literally virtue signaling. Look what I've done. That person sat in his room looking at 4 walls, wondering whether it's worth continuing his life, contemplating suicide, is not going to be enthused that you've walked across the length of England and earned £10,000 for mental health charities. To do what? What you should be is kinder. You should be more considerate. You should realise your place in the society. Be less narcissistic. But oh no, we don't want to do that. It's all about me, 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 me. We should be concentrating on personal growth. And personal growth means having an awareness of others and being kind. But no, it's all... I don't know. Whatever. Is he natty? Is he not? Couldn't care less. Nor should you.